nervous. It was anxiety producing. We've been getting ready for so long, and now all of a sudden we were going to have real patients. At the same time, we were eager for it. We wanted to start taking care of patients, doing what nurses and doctors and technicians are supposed to do. So it was kind of all those feelings together. It was slow at first, and then our first patient came in, and then all of a sudden he was really sick, and we were moving, and then the rest is history.
It was a pretty hectic day for us. I worked in the clinic when we started, and at the time the medical oncologists had full clinics at USF. And so on the first day that we opened, they moved over here, and we had a full clinic day the very first day.
The first day we opened, I had the first pediatric patient. He required a blood transfusion. He came into the front door and fainted because his hemoglobin was so low. He had had a fever, and on my shift, of course, he was ready to get his first blood transfusion. So not only the first patient, but the first blood transfusion here at Moffitt was given on pediatrics.
My husband and I had moved all around the country and finally settled here in Tampa. And I worked in 6 different hospitals, so I had a lot of different experiences. And I decided I wanted to stay in a surgical unit like I'd been working in, and interviewed at a couple places here in town and just was not impressed with the other facilities. So I called a friend of mine from my old hometown in South Bend and talked to her to see where she was working. She was living here in Tampa, and she worked at Moffitt in radiation, and she just couldn't say enough about Moffitt. And I was like, no, I don't want to work at Moffitt. It's a cancer hospital. I don't want to work at a cancer hospital. So I was just going to rule them out. And she convinced me that it would be the wrong choice not to come to Moffitt.
Well, I want to believe that my leadership will transform the organization with the help of all of the nurses at every level in the organization. But I did leave Cleveland with a legacy, and I hope I can leave Moffitt with this legacy, and that is to actually achieve magnet designation.
I came to Moffitt because of the nursing philosophy, and I know it probably sounds sort of corny, but I didn't really want to come to Tampa. I was very happy at my job in Gainesville, but I'd gotten married and my husband was here in Tampa, and it seemed like I ought to join him. And so I was sort of looking around and looking for the right fit in oncology, and I came here a little prepared not to like it. And I had my first interview. The building wasn't open yet, and my interview was in the offices on 131st. And I went in and met with Linda Campbell, and she talked about the philosophy of nursing at Moffitt, and that was it. That was it for me. I knew this is the place I had to be.
I worked in different clinical areas before, and I like to gain experience how it's working with the cancer patient. So I chose Moffitt because of the reputation. It's very rewarding for me. Ever since I started working here, I have a better experiences, and it's very rewarding for me.
I have been looking for another position. I've been in Denver working as a head nurse on oncology unit. My family lived in Florida, so my mother recruited me actually. She said, they're building a new cancer center here. And I said, oh, Mom, every new radiation therapy center calls itself a cancer center. But then I came and I visited, and I saw that it really was a freestanding cancer center, and it was such a great opportunity, so I signed up.
5 years ago, I was pursuing a bachelor's degree in nursing. Moffitt was my clinical site. I loved working with the nurses, the staff here. It just felt like home, and I couldn't wait to join their staff.
I joined Moffitt 20 years ago. I had worked for cancer centers up north. I really enjoyed working with cancer patients. I had vacationed in Florida and decided I wanted to move here, and a lot of people said what a wonderful place it was, and it had only been open 5 years even at that time. So I pursued an interview.
I'd have to say my most memorable nursing moment, one of the most memorable, is seeing a patient that I took care of on the transplant unit after having undergone her unrelated donor transplant, actually meet her donor after several years at a transplant reunion that we had. She was able to experience meeting somebody who gave their marrow to her and essentially saved her life. And it was really very touching for me to see that. Also seeing our patients years after transplant, 10, 12 years post-transplant, living, having families and experiencing their life's moments.
My most memorable nursing experience is caring for this patient. She was dying. I got to know her and her family pretty well. I love here that we can actually take care of our patients during times of joy and sorrow. It just makes me proud to be a nurse.
I had a patient who was dying, and her family was surrounding her at the bedside, and I came in before I left for the evening to tell them goodbye, and they asked that I just stay there for a few minutes with them all. And as I was there, each family member came up to me and thanked me for everything I had done as their family member is laying there dying. And that just always has stayed with me, that they appreciated us as nurses so much and what we did.
I think a piece is understanding the culture, is recognizing the importance, the value, the significance of the care that we provide, and that no intervention, no patient interaction is small or insignificant or unimportant when we think about our oncology patients. And people always ask the question, or say, "Oh, you work in oncology, how can you do that?" And in my mind, I can't think of any other field to work in, because I recognize how important and meaningful those interactions with patients and families are.
I think it's our patients that set us apart. The cancer patients are just so much more appreciative of what we do for them, and they're just totally different. They appreciate any little thing that you do for them, and it's like even some of our logos where you have the hope that's built into there. And I think it's so rewarding for a nurse to get that sort of feedback from a patient, to know that hey, anything you can do for me is going to help me. Because we all know when you get a diagnosis of cancer, and the first thing people think of is, well, I'm going to die or something. And certainly being here at Moffitt, I've seen that's not necessarily the case.
I think the major thing is the genuine concern. I have really almost never run across anybody at Moffitt that does not care tremendously for their patients and wouldn't do almost anything to make things easier for them. And we all know that we didn't give our patients cancer, and we don't need to feel responsible for it, but we do feel responsible for making their lives better.
I don't think I really have an answer to that. I am a Moffitt nurse because I love what I do, and I think part of what I leave here, they talk about legacy, is I have a niece and nephew, a niece who was born at the time I came to Moffitt. She was born 1 month later, and she's become a nurse at Moffitt, and she works on 4 South. That's part of my legacy. So whatever I was being an example to, she must have incorporated that into herself, because this is a person who said sick people make her nauseous. And the day she told me she was going into nursing, I was quite surprised. And then she wanted to come to Moffitt. That even made a bigger surprise to me. I just wondered why she did. And she said, because I make it look so easy. But I don't think it's easy. I think it's hard work, a lot of dedication, and keep the main purpose of why we're here is the patient.